Nitzkin, I'd like for you to tell our audience about some of the latest things in dentures, caps, crowns. You know, we're not baby teeth anymore. We're senior teeth. So what's there for us?
Well, our goal when it comes to treatment is to prevent you from having to go this route. But if you do have some issues, there are some new advanced treatments available to make it more comfortable, less expensive, and easier for you. Okay. Let's start with a tooth that's, say, broken down. Oftentimes, people who are, say, 50 and over have a large number of silver fillings in their mouth. Well, silver fillings tend to start to break down over time. They start to cause the teeth around the fillings to crack and break. Well, in the past, the only treatment available when you have a large silver filling would be to do a full crown. And what a full crown is, it's a tooth that they shave down into a small peg like this, and then the crown then fits over the entire tooth like a hat. It protects the tooth and makes it much stronger. The downside to it is that you have to drill the whole tooth down. But in many cases, in most cases, there's good parts of the teeth that can be saved. Mm-hmm. But now there's a treatment available where we don't have to drill the whole tooth down. We just take out the bad part of the tooth and all that old silver filling, and we can make a 3/4 crown that fits into the tooth like a puzzle piece, and it's bonded into place. It makes the tooth much stronger. It's a lot less invasive, so there's less chance of any type of pain or sensitivity afterwards. And many times we can do this in one visit. You don't have to be coming back, and you don't have to be numbed up more than once. Mm-hmm. And this has been a big advancement in crown treatment. Mm-hmm. Oftentimes it's less expensive than full crowns as well.
It looks a lot nicer too.
Much nicer. Yeah. Much nicer. Now, when you have some teeth that are missing, your options are either a removable partial denture, and this is what a traditional partial denture looks like. Okay. It oftentimes has metal to help connect both sides to it. It's got these metal clips that wrap around the teeth, and that's what holds it in place. Mm-hmm. But now there's new types of dentures made that have no metal in it at all. It's made of a special type of acrylic, and it's flexible, so it won't break.
Oh my goodness.
So oftentimes patients come back and say, oh, doc, my partial broke or it bent, and then they have to make a new one. Well, this is totally flexible. There's no metal in it, and it won't break, and it's guaranteed for life. And it's
That's
very
wonderful.
light. It's much lighter than a partial. In fact, if you like, you're welcome to hold it. And
oh, yeah. And, you know, your mouth is a sensitive area, and you're trying to pronounce your words and say things without lisping. This might be a problem for some people. That's very lightweight.
Yes, and this has been terrific, and patients love it because it's so comfortable to wear.
I can see that.
So oftentimes, when you have a new denture, you can get denture sores in your mouth. Well, because this is so flexible and comfortable and light, you rarely ever have any kind of sore spots like that. The other option for filling in spaces in between the teeth is something called a fixed partial, where we make crowns that are hooked together as one unit, and we use the teeth on either side of the space as anchor teeth. Yeah. So in this case, the two front teeth are missing, and we use the teeth on either side of the two missing teeth as anchor teeth. Then these crowns then are cemented over the anchor teeth with permanent cement.
And they look fine.
They look beautiful. They look like a new set of natural teeth. And the advantage to it is that it's permanent. You don't take it out like you would, say, like a partial denture. So, and
when you do, okay, so now you've gotten to the point where maybe you had gum disease, maybe you're in a car accident, maybe your teeth have to be replaced. What alternative do we have? Is there a partial denture? What is new in false teeth? I hate to say false teeth because they're yours. You paid for them.
Well, the biggest issue with people with full set of false teeth is that the lower denture is loose. The full plate or the full denture is loose. There's just a little bit of gum that the denture rests on, and it's loose, and it's uncomfortable because it moves around. Well, now there's treatment available where we could place a couple of small little snaps in the gum, and then we could place the snaps in the denture. So now the denture will snap into place like this. It. And your full denture will be nice and tight like this. And will come out. You don't need any more denture adhesives or denture paste because the denture is nice and tight. It's comfortable, it fits well. You don't have to worry about it coming out if you talk or sneeze.
I mean, if somebody wanted to replace one right now, they could come in and still have that done, or you have to do that?
Well, we would do our diagnostic, we would do an examination and a treatment, we would take the x-rays and make sure that you would be a good candidate for it. But with most people, they can have a snap-on denture, which is really nice. Now with upper dentures, full dentures, we could, in most of the cases, we could make them nice and tight and comfortable.
Yeah.
But it's the lower that's the big problem.
That's
the
the
issue.
tricky part. Yeah.
And that's where this really shines, because we can make a lower denture as tight as the upper denture.
We're going to take a short break, and we'll be right back here at the Livonia Dental Care Office with Dr. Jay Nitskin.